We've all seen ads like this one.
Depression used to define me. Then my doctor added Abilify to my antidepressant. Now I feel better.
Depression drugs make up a multi-billion-dollar arm of the pharmaceutical industry, but medication helps just a third of the millions diagnosed with depression. Doctors and patients also rely on a range of alternative treatments, some on the cutting edge of science, and others that rely more on unconventional methods. WGBH News reporter Ibi Caputo has our story.
Greg Beach has suffered from depression since he was a child. He's tried medication and talk therapy, but his depression continued. Then his friend gave him a book on meditation.
Taking time to meditate and, taking time to be, just to be.
It made a huge difference, and now Beach meditates 15 to 25 minutes a day. Once considered a fringe treatment, the medical establishment now sees meditation as a legitimate option.
It's not like a prescription drug to heal a specific ailment. It's kind of like exercising, just kind of make or practicing anything. It's to build skills of resilience.
Tom Padula is a psychotherapist and clinical social worker who teaches meditation to some of his patients with depression.
It just kind of cleans out some of the cobwebs and helps us think more clearly and, again, connect with the present moment and stay in the present moment.
Padula says meditation is a great tool, but it only works for some patients.
If a person is in a really deep depression, it's probably not the best time to teach mindfulness meditation.
That's a situation Laura Murphy found herself in, a depression so deep it was physically debilitating.
My body shuts down. It's a physical depression, and it's treatment resistant, which means I've been through a lot of drugs.
Then, a year and a half ago, Murphy tried something relatively new, transcranial magnetic stimulation, or TMS.
I've tried, every available technology to help. This one actually worked on my brain.
TMS uses magnetic pulses to stimulate regions of the brain that regulate mood. It's like someone tapping on your head with a magnet, explains Daniel Press, director of Beth Israel's TMS program.
The magnetic field passes through your scalp and skull, but it actually creates a small electrical current right on the surface of the brain. It isn't enough electricity to hurt the brain in any way, but it absolutely is enough to stimulate it.
But TMS is not widely available, and researchers are still learning how to use it most effectively.
TMS is still a little bit in a learning phase in that the treatment that we have works for a lot of people, but not everyone. And our goal really is to get to work for everyone.
While that universal treatment remains elusive, those suffering from depression at least have more options than they used to. For WGBH News, I'm Ibi Caputo.
So how effective are alternative treatments for depression? Here to discuss that is Dr. John Denninger. He's the Director of Research at Mass General's Benson Henry Institute for Mind-Body Medicine. Welcome to Greater Boston, John.
Thank you very much, Emily.
So meditation, that's been around for centuries.
Centuries, millennia.
Yeah, there you go. And is this new to it? Is this a new acceptance in getting rid of depression, or has it always kind of been there, but now they're trying it more seriously?
Well, I think that obviously these are techniques that have been practiced for many, many thousands of years. It's really only recently, I think really since Herb Benson, who founded our institute, started talking about the relaxation response, that we started thinking about ways of bringing techniques like meditation into medicine more broadly. And certainly over the last 20, 30 years, people have used it for illnesses like depression as well.
But you have to be willing to go along. I look at those people and I'm thinking, what are they thinking about when they're meditating? I don't really understand the whole process and how that can, do you tell them what to do while they're...
Yeah, typically when we work with patients, we start out with very, very simple kinds of meditations. Things like just focusing on your breath, doing things like focusing on a word or a phrase that's meaningful to you, or doing what's called open awareness or mindfulness meditation, where you are sort of focusing on whatever goes through your mind. The important thing is that there's no perfect way to meditate, and the important thing is that you try it, and if it works for you, that you continue to do it.
I want to bring Dr. Dan Press into the discussion. We just saw you in the piece there. You do the electromagnetic resonating. You said that in the piece you would like to get that to work for everybody.
Yeah.
Do you really think that that's a possibility? We've all had friends who've gone through horrible situations like Miss Murphy did. They tried everything and it didn't work.
So I don't think it probably would work for everyone, but if we have a better handle on the brain circuitry that's involved in depression, then we have a better chance of using non-invasive brain stimulation on an individualized basis to modulate those circuits in the person. And I think we can make it more effective than it currently is. I think most centers are finding 50 to 60% of the patients are getting better, and I think we can improve on that.
You both work with this every day, and there's so many different kinds of depression. And anxiety is one. That seems meditation might work for that. Would magnetic resonance, would that work for anxiety, for instance? Or would be?
So certainly the most data is out there for treating depression. But there's some evidence that we can target different circuits, particularly in the right side of the brain, the right hemisphere, to actually help anxiety. And I think both of us would agree that if we can get the circuitry, we can potentially work at it different ways using some combination of non-invasive brain stimulation along with lifestyle and meditation interventions.
Right. Does either of you think that the other guy's method is ridiculous?
Absolutely not. I've sent my patients to get TMS. Yeah. Absolutely. It's a very useful technique.
Right. And we really are studying exactly the same brain circuits. The brain circuits that activate when someone is meditating look like they have salutary or ability to actually help the brain on a number of functions. So I think we're just looking at stimulating the same circuits, just one way is sort of non-invasively with meditation, another one's non-invasively with a very powerful magnet.
Yeah,
when somebody has one of these debilitating depressions, is your treatment just to get them kind of through the next phase, or is there actually a cure?
I would say there's no cure. Depression is typically a lifelong, often recurrent illness, but we never stop trying to get people better. We want to get people, just like with, if you have high blood pressure, we want your blood pressure normal. If you're having, high cholesterol, we want to get your cholesterol normal. In the same way, with depression, we keep trying to get people back to their normal selves. We don't always get there, but we certainly try to get as close as we can. And techniques like meditation and other mind-body techniques can really help, especially when people are starting to feel better, whether they've used TMS or some kind of medication, to get back to their normal selves.
Have we traditionally, do you think, Dan, relied too much on medications, drugs, to get people through this?
No, to be honest, if I'm being honest, I don't think that is the case. I think that depression is under-recognized in general. I think there's a lot of people out there that have depression that haven't told anyone. And so I certainly think that in individual cases, sometimes we will be treating things that one wouldn't call depression or one would call a personality trait. But as a general sense, I think it's probably an undertreated condition rather than an overtreated one.
And so if drugs work, then that's the way to go.
Well, certainly drugs have their own side effects, but they can also be powerfully beneficial. Yeah.
All right. Dan Press, John Denninger, thanks so much for your insights.
Thank you so much.